Hey, this is Jill Murphy from Pharmacy Times. Before we get started today, one of our top stories on Pharmacy Times is about a study that finds the total cost of care for CAR T and post treatment events exceeding $1 million. Today I'm speaking with spinal muscular atrophy, also known as SMA, patient Nick Sinagra about his treatment journey and his experiences with two different SMA treatments. How are you doing today, Nick?
I'm great. How are you?
I'm great. I'm so happy you're joining me.
Yes, thank you for having me.
Of course. I wanted to start by asking if you could give me a quick overview of your background and your diagnosis.
Yeah, sure. So I have spinal muscular atrophy type 2. It was originally diagnosed as type 1. I was diagnosed when I was 17 months old. So it was originally diagnosed as type 1 simply because of the age at which I was diagnosed. But then as I got older and, you know, started to deal with the disease a little bit, they eventually changed that to type 2 because my symptoms fit into type 2 and a bit more than type 1. My parents started to notice some issues when I was 6 months old. I wasn't really progressing physically the way I should have been, and they actually had reached out to a radio show to ask a doctor that was hosting a radio show about some of my symptoms. And the doctor basically said, that I needed to see a neurologist immediately. So, they took me to a neurologist and did some testing, did a muscle biopsy, and that's how they determined the SMA. I've had the trach since I was 3 years old. I mean, overall, I think I do pretty well. I mean, I think all things being relative, I do pretty well. And I'm sort of used to SMA at this point.
And I wanted to go off of that with asking you how you first learned about Spinraza, the treatment, and what your experience was like since you were one of the first people to receive this drug from what I read.
Yeah, so the story about how I learned about it is kind of funny. So I at the time I was working at a job where I would get emails constantly. When I say constantly, I mean I get emails constantly. My phone vibrates, and I'm sure like most people. And it was Christmas Eve, and I was having lunch with my mom, and my phone vibrated, and I got an email, and I thought it was something work related. You never know, even though it's Christmas Eve. But I happened to look down, and there was an email from MDA, and it said that Spinraza was approved as a treatment for spinal muscular atrophy. And I don't think I really knew how to react. It was one of those things like, are you serious? Like, this is Christmas Eve, and I get this email, so I something like that. I'm like, she was sitting next to me, like, look at this email. And she's like, is that a joke? Is this serious? Like, what's going on? So I read the email and then, like, started looking stuff up. And all of a sudden, just trying to figure out what was going on. So that was sort of how I initially heard about it and heard that it was approved. As far as like my experience, I mean, for as long as I can remember, I always said if there was a treatment that I wanted to be the first person to get it. And I don't think I was necessarily the first, but one of the first is, it's been something like a dream almost, like a dream come true because I never knew if this would happen in my lifetime, and if it did, what it would be like. So the whole thing is just like a dream come true, and every day is just, you know, you're thankful that it finally happened.
Absolutely. And also, after this, you switched to Evrysdi. What did you expect from this change, and what was the factor that overall made you switch again back to Spinraza?
Yeah, I mean, when Disney was approved, I mean, I sort of had a few expectations. With Spinraza, because it's given every 4 months, there is a drop off in strength at exactly the 13-week mark for me. I can never set my calendar to it, and time it to exactly 13 weeks. I can tell that I'm just so together, but tired and a bit weaker. So with Wisdy, because it's daily, uh, yeah, I was sort of hoping that drop off would not happen. Anticipating that that the daily dose would sort of take care of that. Other than that, I was really expecting, to the same results, to gain some strength and to feel good and feel like a boost of energy. Other than that, unfortunately, if Disney, for me at least, I can't speak for everybody, but for me, it just really wasn't effective. After being on it for a few months, I just started to notice that I was getting weak, and I just wasn't. Not only was I not feeling good, I was feeling bad, and that to me was very scary. And even though Spinraza you have to get injected in the spine, which isn't necessarily a pleasant experience, it's certainly worth it because it's, for me at least, it's definitely a lot more effective.
And like you were saying, you've had some challenges and some great obstacles that you overcome being a part of the SMA rare disease umbrella. What would you say were your biggest challenges living with this disease, and how would you describe your patient journey to this day right now?
You know, uh, I've been asked that before, and it's always hard to describe it because I think, every day is almost sort of a challenge in a journey. Whether it's health issues or wheelchair issues or, you know, locating in different environments and all that. I think that there's a day-to-day sort of challenge that is always seems to come up. The last couple of days I've had some wheelchair issues, and a couple of months ago I had the issue with the Disney, and you know, dealing with the pandemic right now and all that. So I think, you know, but at the same time, I think it is like I'm used to it. Like family and it's like people see us and it's like, oh, like you do this and you do this. It's like, yeah, but we're used to it. This is part of life at this point. So, it's a hard question to answer, sort of, because, there are daily challenges, there are bigger challenges such as school LDOs and getting healthcare logos and getting a job and all that. But I think just sort of the day to day is sort of what I think of, and like I said, it's a challenge, but at the same time, we're also used to
And what do you feel that healthcare providers,
it.
such as pharmacists, need to understand about the challenges that you face living with SMA? And like you said, how it changes from day to day to best help them treat you and other patients.
Yeah, I mean, I think it's important to understand that even though I have this disability, this disease, that I do try to live as normal of a life as possible. I work a lot. Um, I started my own business. I try to be social and have friends and date and hopefully get married someday and things like that. So I do think like, you know, there is that aspect that you try to much of a normal life as possible. Whatever normal means. I don't even know what normal means at this point. But you do, at least for me, I have as many hopes and dreams and all that as anybody else. And whether, like I said, whether it is something with medicine or healthcare locals or getting assistance or whatever, I think the goal for me has always been probably the same as you and probably the same as anybody else. Just trying my best to do what I want to do and to succeed as much as possible. And I think that a lot of people don't realize that a lot of the time that you do, even though you have the disease, that you do want to live a normal life and you do want to be as normal as possible. So just what I would say is like for any healthcare workers is just to sort of keep that in the back of your mind.
And is there anything else that you hope to see for the future of patients with SMA or any healthcare providers who are treating people with this disease that you hope to see in the near future for improvement?
Yeah, I mean, I think that I really have two answers for that. I mean, first of all, you know, it's like government programs and financial programs. I mean, I'm lucky that I'm able to work and I'm able to have insurance and all that. But I know that there are a lot of people that aren't that lucky. So I think, getting some of these programs and waivers and government assistance and all that, a little bit more consistent for some people. That would be, a hope that I have so that they can try to live as normal a life as possible. But I mean, specifically to SMA, you know, Spinraza has done a great job for me. I mean, I feel good. It's a boost of energy. I've seen a lot of people have a lot of success with Spinraza and, Evrysdi at the same time. And if it can, do keep doing that milk for people. And, if it's given to them as a baby, is that going to make it almost like a cure? Is that going to make them asymptomatic and that we going to find an actual cure someday instead of treatment? Or in addition to a treatment, I should say. So, especially the SMA, I would love to get to the point where, you know, people that are diagnosed with it really become asymptomatic and it's no longer a problem for their lives.
Nick, thank you so much for joining me again and for sharing your story with us.
Absolutely. Thank you so